One of the biggest surprises about asthma is that you may go through life with the condition never knowing you have it. Just as bad is the closet asthmatic who withdraws from many activities without realizing that asthma is limiting their ability to live life to its fullest. Dr. Michael Wexler is an expert on asthma at Boston's Brigham and Women's Hospital. He explains.
A closet asthmatic is someone who either has asthma and doesn't know it, or has asthma and stops doing things because of their asthma.
It may not take much to trigger spasm in the muscle of the airways, closing them down.
There's many different triggers that are associated with asthma, and those include environmental triggers such as exposure to dust. There can be outdoor allergens, pollen, trees, grass.
If you suffer any of these symptoms, see your physician for a complete exam. Coughing, wheezing, shortness of breath, chest tightening, a band around your chest at time, tightness in your throat, sounds in your throat, chest pain. Your doctor will be interested in the timing and quality of pain to distinguish it from heart disease. Your doctor will want to know about your family history and environment. Doctors also look for precipitating factors such as infections, evidence of heartburn or post-nasal drip. In a physical exam, doctors look for clubbing of your fingers, nasal polyps, pale and swollen nasal linings as evidence of sinusitis. Your doctor will listen to your chest for wheezing during inspiration and expiration and want to distinguish between chronic asthma and an acute attack.
One of the main features of patients who present with severe asthma or acute asthma is their use of accessory muscles. They need to use other muscles in their respiratory tract to try and force the air in and out.
To confirm the diagnosis, you'll blow into a spirometer to measure the speed with which you can breathe out, which slows with asthma. If you're having symptoms, your doctor will want to determine if you get better with a medicine called a bronchodilator. If you're not currently having symptoms, the medical team will want to replicate your symptoms to cinch the diagnosis. This is called bronchoprovocation testing.
In some circumstances, one gives a stimulus to provoke asthma, and that is often done with methacholine, which is a substance which causes constriction of the airways.
Doctors are looking for a decline in your ability to exhale.
If someone's lung function declines by 10%, 15% of their baseline breathing test, that would suggest that they are having some type of asthma difficulties. They're having some type of respiratory difficulty that warrants an intervention.
If you complain about breathing problems during exercise, you'll do baseline testing and then exercise on a treadmill. Then there's a basic chest x-ray.
One does a chest x-ray in order to exclude other conditions such as pneumonia, heart failure, or other respiratory conditions.
If your symptoms are worsening or you have unrelenting symptoms despite therapy, you need to be seen by an expert pulmonary physician or allergist. With worsening symptoms, doctors try to identify the cause, and that might be non-compliance, not using inhalers properly, a new type of allergen, a worsening of an underlying disease, or side effects of a medication. Asthma is a disease that kills thousands every year and sends tens of thousands to the hospital. With proper management and an action plan, your risk of either will drop dramatically. See our next video on the treatment for an action plan.